And I know you talk about theta healing, and
Yes.
it's a really interesting practice. Can you go into that and explain what theta healing is?
So in my practice, I first started coaching, health coaching around like 7 years ago. And then I did it clinically. I was a health coach at Mount Sinai. Then I received my clinical degree and became a dietitian, continued counseling on health and nutrition related topics. And this is when I started to see the pattern that people think all they want is a meal plan. Just tell me what to eat, just tell me what to do. And it is, something that I could provide for them, right? The supply and demand chain. If that's what you want, I'll give it to you. But what really produced a long-lasting result is the change in their mindset. And that's something that not easy to do. And then there are subconscious beliefs, right? So at first, as a coach, I was able to, offer a different perspective, opportunity to look at things different. That's one thing. But then there's the reoccurring things, like when you wonder, like, why is the bad things happen to good people? And then you're like, how did they manifest that? So theta healing is something that I've been fascinated. I've experienced it first on myself. And I started practicing more meditation. Even in my package, for my clients, we do meditations, visualizations on how they want to feel and where they want to be 6 months from today, right? For them to set their goal in motion and like start doing some, find this motivation from within. But what theta healing offers is really, it's a meditative practice where we first talk and realize what's the biggest fear, what's the biggest thing that holds people back. And most of the time, it all boils down to like three or four things. It's the fear of not being loved, fear of not being accepted, and fear of being, criticized, being not like everyone else. So we all deep down, like you said, we're like, hedonistic creatures. We're looking for love, acceptance, and some sort of pleasure, even though, we might not look like it, especially when we live in the big cities and it looks like it's all driven by achievement, the income and all these things. But deep down, if we really dive in, like, what are we doing this for? It's all to deserve someone's love. And, there's a lot of different things, but like this is just this is an example I gave you. And then when we understand that, we're able to, like during this meditative practice, I'm able to give this feeling to these people for them to like see themselves clearly, to get to know their subconscious mind, right? And even offer some change, So most people cry during theta healing because it goes deep, and those fears come to the surface. And I'm someone who's able to hold space and offer that healing and verbally first, and then communicate that feeling to make people to make themselves feel so so they can elevate themselves to the next level. So, and that is much deeper than just nutrition and a lot of things, like you see, like even the food, right? People come to me and say like they want like some kind of food, recommendations, but what they want is to have some sense of control in their life, right? That they have power to create change, to control something, right? And the food is just a tool that they're using, right? And I give, sometimes I'm able to go into this, into their subconscious beliefs. Most of them are limiting beliefs, and provide that healing. And suddenly that alleviates so many issues related to, all these minor things that food related or, like weight related. Like even for me, remember how I said I was in my mindset when I was size 2 and I wanted to be size 0. In my mindset, I wasn't good enough. Like I wanted to be different. Like in my mindset, I was trying to prove myself something, that I'm lovable. And that's what theta healing done to me, that I'm size 4 right now and I'm totally lovable.
Yeah. It's incredible how many, belief systems we have in the subconscious that we have no clue that they were constantly playing over and over and sabotaging us over and over. Yeah. And that is why isn't this happening? And everything I'm doing is right. And a lot of the times what we see is that you have that negative belief system that's deep, deep down there that you don't even recognize, and you need to clear that. So I find things like theta healing, other spiritual practice, Ho'oponopono, trying to clear that, right? As incredibly important. Whereas most people they come, at least to our clinic, I'm sure to you, and they just say, give me what I need to eat, give me any pills. Well, I want an IV and that's it. And they don't want to dive deep into that because it doesn't sound like medicine, or it doesn't sound like science when you say you have, deep subconscious belief systems. It's just, my belief is that I want to get better, right? So how do
It's
you
also
address that
not
when people do that?
it's also not socially acceptable. Like, for example, if you were struggling with some health issues, right? Where do you go to heal your subconscious beliefs?
Yeah.
Right? To a therapist, to what? To a shaman? I don't know, right? So it's not. So that's why I hold a lot of compassion to these people, and that's why I work in 6 sessions, like 3 months program. Like, I get to establish this trust and rapport that people get to know me and able to open up, because going into subconscious beliefs requires a lot of vulnerability. And that's scary to open up like this to a stranger, or like, I don't know you. Why am I going to talk? Like, it's much easier to take what pay your money and walk out and, be strong and be responsible for your health, right? And a lot of people never go into subconscious because it's too vulnerable and they're not taught, the childhood environment like never taught them to, that it is actually safe to be vulnerable. And a lot of people live in this, believe that vulnerability is weakness, and don't go there. Just be strong, act strong, and hold it together, and just survive through it. And this is how this mentality eventually leads to a mentality of, I'm sure you know how people get older and they get sick, right? And they don't want to do anything about it because that's what they associate aging equals sickness or disease, right? And it's like, well, that's what happens. That's what happened to my mother. She got diabetes, right? That's what I'm going to get. And this empowerment, that's part of, that's how society works right now. And that's how all the medical facilities are thriving. And that's why I quit my master's program at NYU, because that's where I was taught to just be part of the system. No one's even like me, clinicians, like when I was being trained to be part of the system and being part of the NYU hospital settings, and I was going to the dean, I was like, what about prevention? What if I want to help people who are not, already like post-surgery, and have people who are not at the position of, not being able to make decisions for themselves, but a dietitian has to walk into rooms like, this is what you got to do. Like, I know you don't, you got to listen to me, right? What if I want to empower people and create change in their lives before it's too late, right? And I didn't get answers. That's why I dropped out of the program, and I applied 4 times. For those who are being this encouraged, I applied 4 times to get into master's program at NYU, only to drop out. So I'm licensed. I've gone through the dietetic program, but I didn't need the master's degree after my name because I didn't want to be part of the system that encourages these what is it called, like sickness care, and for me it's the health care. It's when you have your health and you care for it enough to create changes before it's too late, right? But when it's sick care, it's when you only start to care when it's already in the state where it's almost like, you just got to manage it, right?
Yeah. It's disease management. And it's not only that the medical system and establishment doesn't even want to answer those questions when you ask about those. It's that they'll shun you. They'll basically say, well, you're crazy. Like, this isn't medicine, prevention. Like, how do you do that? We deal with sickness and we deal with symptoms, and they just drill it into you. And that's the problem with medicine, is that it's not open-minded. It's this is the right way. This is the way we've always been doing it. We are normalizing disease. You're going to get sick when you're older, but we have a pill for that. Don't worry. I'm here for you when you get sick. And that makes someone, okay, it's okay to get sick, when it's really not. Sickness is terrible. Ask any patient after a while. They will do anything to have their health back. But when you normalize it through the system, well, that's what you get. You get a society that is sick because you've normalized sickness as you age. And I have to say, not even as you age, as sometimes at a very young age, where you're going to have to live with it forever. And I do think it's a huge crux in what's happening right now, and a huge, downfall of modern medicine.